This is Optimum Health Solutions, and today we are talking about prevention of blindness in children. We have in the studio Professor Adedayo, a consultant ophthalmologist, who will talk to us about prevention of blindness in children. My name is OJ Odia, your regular host. So, Prof Adio, you are welcome,
Thank you very much.
and thank you very much for all the patience and you stayed with us for quite a while for this program to take off. Now, what are the common causes of blindness in children?
Okay. Well, blindness in children is very important, just to by way of introduction. Why? Because if a child goes blind, when you compare it with an adult that goes blind, it is of much more uh, gravity. For instance, if a child goes blind as a baby, likely live for up to like 70 years, and then you compare it with an adult who goes blind at 65 or at 70. The number of years that that child has lived compared without vision, compared with the adult, is much more. So that is the reason why it's so important to handle or talk about this much more frequently. And this is a very good opportunity to talk about this. So in terms of the causes, we have those causes that happen when the child is being conceived, the ones that happen when the child is being born, and the ones that happen when the child is born, when the child is playing around and all that. So in terms of the ones that happens when the child is being conceived, we could have cataract, which can happen as a result of exposure to rubella, which is a viral condition that women can develop when they're exposed to what we call the rubella virus. And we also have conditions like retinoblastoma, which is a condition which arises from a genetic mutation in the retina. So that's one or two of them for those that happen during the time of conception. But at the time of birth, we're talking about the problems that can happen at the time of birth. Somebody could have a baby that has difficulty in initiating crying, which can lead to brain damage,
Damage.
what we call brain blindness. So that kind of baby may not be able to see. And also, we also have other conditions like retinopathy of prematurity, which happen around the time of delivery. The child is not born blind, but because the child was born a little bit premature, the cells, the blood vessels that are supposed to make the eye to see, so to speak, don't develop properly. And so that kind of child, if it's exposed to excessive oxygen, can develop what we call retinopathy of prematurity, which can lead to irreversible blindness. Then we also have other causes around that time when somebody develops an infection of the eye, ophthalmia neonatorum, or any of those things from a pre-existing infection in the mother, in the vaginal tract. So such a child, if it's not taken care of, can lose the vision. Then we also have other causes, like when that develops along the line, um, when the child is playing, the child could have trauma to the eyes. So this kind of, especially among boys, is more common. When the child is not supervised, when the child is playing, can develop trauma to the eyes. And we also have other causes like developmental cataract, developmental glaucoma, which could be as a result of some problem that the child had, or a genetic problem also, or part of the rubella syndrome that I was talking about initially. So these are some of the common causes that are within the area where we are living at this time.
Okay, so if we know the causes, what can we do about them?
Okay, for instance, we're talking about the ones that happen around the child, like for instance, cataract, child is being conceived and all that. All mothers, all women within the childbearing age, to prevent a rubella syndrome, should have the measles rubella vaccine. If they don't have it, especially between 15 to 45. This kind of women, you know, could get pregnant. So if you are pregnant and you don't have that vaccine covering you to prevent your baby from developing rubella, then the child will develop rubella. Especially if they go to highly populated areas,
Exactly.
densely, they go to the market, they can catch a viral. They might even think it's just a small fever, some cold or the other with a little bit of rash. And then the mother already, even before she may have missed her period, which is the time when the eyes are being formed, could develop
And the
a
vaccine is
cataract.
one of
And the vaccine, yes, is one of.
vaccine. So
So
once
if
you
the
have
mother
it, you
does
have
not,
it.
yes, once you have that vaccine, which unfortunately is not part of the free ones.
Yes.
Mothers have to pay for it. And when you hear payments, they don't know
That
that when
becomes
you
a
pay, that becomes
problem.
a problem.
Yeah.
They don't know that if you pay and get that vaccine, it saves you a lot of problem. Because even if a child develops a cataract, it's treatable quite all right because it's the lens that has, but the child will also have other multi-systemic problems, which are very difficult and very expensive to treat, much more than that
Yes.
few thousands that you need to treat to prevent yourself from having that condition. So that is about cataract, and which can also cover glaucoma also, because glaucoma is also part of the congenital rubella syndrome, could be part of it also. Then once a child, if a child is born premature, such a child must be examined within 3 to 4 weeks of birth. That way, you pick up that condition much more, which is part of our job description. But the babies are with the pediatricians, the neonatologists. All mothers should know, especially if they know that they are prone to developing premature babies, or they have, to deliver a premature baby, or the obstetrician knows that this woman could, because of multiple babies in the womb, could develop premature birth, or they are going to premature birth, labor, then should have that child examined within 3 to 4 weeks of life. You know, in keeping the baby alive, you need oxygen.
Yes.
But there are things to do to make sure that the oxygen is not given to the point that it will be detrimental to
To
the
the
child,
baby.
to the baby's vision. But you see, they have to keep the baby alive. So once it is picked up on time, there is what to do, and it's quite simple. It's when they don't pick it up on time that is the issue. So all babies that are premature, like tomorrow now, I'll be examining quadruplets that are going to be referred to me that have had a lot of oxygen. So those kind of babies must be examined on time. If you pick up that condition, there are certain features that you see. You give them a simple injection and it's gone.
Okay. So
Most times just once and it's
does
gone.
the oxygen toxicity affect the retina?
Yes, the oxygen
Okay.
toxicity affects the retina inside of the eye that the child will use to see. And if that is not dealt with to reverse the process with that injection, it continues until it leads to irreversible
Okay.
blindness.
Okay.
You know. So there are other conditions also in terms of prevention, like retinoblastoma. It's a condition that it's a malignant condition of the retinal cells, which are the cells that somebody uses to
To
see
see.
in the eye. If it becomes malignant and it's not
Malignant
picked
means
up, malignant means turns
like
cancerous.
cancer, yes. Yes.
Yes. So if that happens, all we need is early presentation. If the mother presents early, there's a way it glows in the night when it is dim. It looks
Sometimes the
like a
mother
cat
said that
eye.
cat eye.
Exactly. If the mother sees the cat eye, she should not think that, oh, it's nothing. It must be examined. The child must come to the hospital. Unfortunately, we have many mothers in the rural areas, riverine areas, who may think that this is,
Something else.
not, yes, maybe something that maybe they if you ignore it or wait for a bit. But the longer you wait, the more difficult it is
To manage.
to treat. Yes.
Okay.
So those
Okay.
are the at least
So,
prevention, unless there are other questions.
so these are some of the things that we'll look at
Yes,
for.
exactly.
Now, if the babies are born in maternity homes, sometimes doctors are there, sometimes only midwives, sometimes traditional birth attendants. What would you advise maternity homes to do, for example, to make sure that some of these conditions are picked up early?
Okay. Well, especially mothers who are high risk, those who are first timers, those who have had plenty of babies, maybe up more than 4 and up, they should deliver in the teaching hospital. That's the best thing. But for some reasons, if they happen to be in these maternity homes, the people who are caring for them must ensure that the eyes of the baby are checked before discharge.
Okay. So,
And then anytime they come for immunizations, they must be examined. And also, they must be examined before they enter school, periodically like that. Before they enter, if they come for immunizations at every point, there's no way
I will not
that
be
they
picked
will
up.
not be picked up.
Is it only ophthalmologists that can pick them up, or just any
No,
doctor can pick
any
it up?
health worker
Mm-hmm.
can pick the once you are trained to look at the eyes, to examine
Ophthalmology that this baby doesn't
exactly
seem to be seeing well, or looking
exactly
at the
this
right
needs to,
direction, and so on.
once the indications are there, usually there's supposed to be a set of rules that people should be given when they
Like
are
guidelines.
yes, guidelines, that when they are examining, when they are delivering babies, these are the things to look out for. Not just the eyes, other parts, but in terms of the eyes, they should look at the eye, examine that is the eyes, are they equal sized? Is there any eye that is red? Is there any discharge? Is there any swelling? Is the eye glowing a little bit much more than the other?
Yeah.
And then if you put drops to open the eye, or because there are special drops that we put in so that we can see a lot better what is going on inside the eye. Is there anything going on within those eyes? For that one, maybe a specialized one. But when there are indications that show that this baby could need the services of somebody who can, you call them
So there could
in.
be a referral.
Exactly.
So they examine this and make sure that these babies are looked after as quickly as
Exactly.
possible.
Yes.
Now, what can we do for some of these conditions? What could be done? What would I advise that the mothers ensure that can be done for them?
All mothers need to understand that the child may not complain that there's something wrong. So you must have a high level of, observation. When something is going wrong, if you don't observe it, you may be at the losing end, especially in the way the economy is now. You have to pay out of pocket. So prevention is always better than cure. Observe the child's eye properly. And for instance, if a child should have a cataract, what to expect when you bring the child to the hospital is, for instance, if it is in one eye, that surgery needs to be done for that baby. And it needs to be done before the child is 6 weeks and older
6 weeks old.
of age.
Yeah, okay.
And if a child has cataract in both eyes, that surgery needs to be done before the child is more than 2 months, 8 weeks of age. From the time of diagnosis, the child should be brought earlier so that surgery can be done
Quickly.
on time. These things are visible. Once you see, the child will open the eye and then you look, you will see that there's a problem. Usually for cataract, you will see a white appearance within the pupil. It will not look like any other person's own that is clear. Usually our pupils, which is the brown area that we're looking at behind the clear area in the eye, we call it the iris. So there's a small opening in between called the pupil. In that pupil, you will see a white appearance. That is a cataract.
Okay.
For instance, now, if a child now has glaucoma, you might, if it is in one eye, usually they will detect it on time because one eye will obviously be growing bigger than the other. In children, if they have glaucoma, the eye grows bigger. But in adults, it does not do that. But in children, the eye begins to balloon.
Because of the pressure.
Because of the pressure. And their tissues are still very pliable.
Yes.
So it stretches and then grows bigger. But when it is in both eyes, usually they don't come on time. You might even be thinking that it's like their great grandfather. It will be growing bigger at the same time. So I think that, maybe this child looks like somebody else in the past, So, but the bigger the eyes, the poorer the outcome. So there are other signs that you will also notice in such children. You might notice that the eyes are watering. That means the tears are coming out. You might also notice that the child is not wanting to look at light, and the eyes are now, instead of clear and brown, the eyes will now be gray. So, and it begins to bring out, sometimes suddenly it just turn white. So by the time you see something like that, that's a very serious emergency. and must be taken to the hospital. Usually you see the pressure very high. Normally the pressure in the eyes should not be more than 12, 13, 14. But when you see children like that, the pressure is 35, 45, in some cases 65. And such a child can go irreversibly blind if nothing is done on
Okay,
time.
okay. You just go blind and that's it.
And that's it. It's
Thank you
irreversible.
very much. So we've seen what so it's still prevention,
Yes.
and if the child comes early treatment.
Early treatment.
Okay. Now, supposing these two do not occur, so the
Okay.
child still comes with poor vision or may even be blind.
Hmm.
So what do we do thereafter? Will
Hmm.
the child not live a healthy, normal life?
Hmm. Well, it's a pity we have people who go blind for no fault of theirs, but maybe some neglect or the other, or it was a condition that was progressive that was could do nothing about. But if somebody goes blind, it does not mean that it's the end of life. Actually, it doesn't mean. But if it's better, of course, to see, which is universal. But if you now have problems with seeing, maybe your vision is not as clear, we call it low vision. There's what they call low vision aids. And some of us are specialists in that area where we give devices to make the child to see better. Especially albinos. Albinos have that condition where if you offer them low vision devices, they see very well. And if now a child goes blind, that means the child cannot see and has to be led around, or cannot see sufficiently enough in a classroom with other children, then what to do for such a child is to rehabilitate them. You will find out that many of these children, they know that they don't have any additional disability. It's just the vision. So somebody who has problems with vision, what to do for such a person is to ensure that they are rehabilitated, where they are taught how to move around on their own, they are taught how to get information, they are taught how to give information so they can do government exams. Somebody does not need to read anything to them because they know how to read it. They can learn Braille. They can also learn how to use smartphones. All the social media that you and I are doing, they can learn how to do all those. So we do all that in the center that I work in. So anyone who has issues with vision should know it's not the end of life. What normally happens is that they ship such a person to the village.
Okay.
Which should not
hide
happen. And hide
somewhere.
the person there. And you will even be surprised that some inside this Port Harcourt, there are many of them who are blind and at home doing nothing. Or they put them in school and they are helping them to do exams from year to year until they reach a stage where, where they now have to do government exams and they are now stuck. Well, it shouldn't happen that way. So if somebody goes blind, it's not the end of life. Should be rehab, and it's for a time. You don't have to put the person in a blind school. What they need is 1 or 2 years of rehabilitation. Equip them with the devices that they require. They need a guide cane. They will need a recording device. They will need a laptop. They will need a printer, all those ones which they can get in the school. And then they are good to go. They can, if they don't have a printer, they can use a manual typewriter and then they print out their exams. They have a recording device that they get the information from and then they do their exams. So they can go to any length of education.
So at least one of the other senses could be developed.
So yes, at least, yes, to some point, yes. Even if they are having problems with hearing, not total deafness. If they can have some level of hearing, at least in this environment, they are able to do better. But there are some environments where they have the facility to be able to do both deaf and the person that cannot see.
So, thank you very much.
Thank you very much.
In fact, I'm so thrilled that I enjoyed it so much that I don't even know how to ask what other questions to ask again. So, thank you very much. We're particularly delighted that you are here today. And it's a topic that I think will be interesting to mothers to be, or let's say people who are going to be parents relatively soon. They want to hear this, and so that this blindness in children can be prevented. So, the emphasis here in this program is prevention. So, but when it does occur, what can we do? Secondary prevention, by way of rehabilitation and so on.
Yes.
So thank you very much for coming.
Thank you very much, sir.
Yes, that's the program for today. Thank you very much for listening. Please subscribe, share, and ensure that you like this program. Thank you very much. Bye for now.